University of New Mexico College of Pharmacy was founded in 1945 and is the only pharmacy school in the state of New Mexico.
There are many things that make the UNM College of Pharmacy unique. First, it's part of a large academic health science center that also provides an opportunity for great interprofessional education. And with that, you have cutting-edge research, you have new healthcare models.
Models like Project ECHO, which stands for Extension for Community Healthcare Outcomes. The program utilizes technology to bring medical experts together in over 400 points of contact throughout the state, covering 13 different disease areas. This is critical to deliver best practices care to the many patients in rural areas.
Pharmacists can really help in this because they can really link together all the specialist advice and come up with a great plan for trying to treat the patient.
And one by one, they present patients that they have in their clinics to experts at the university. These experts consist of specialists, nurses, pharmacists, and as these case presentations occur, these specialist teams give advice on these patients to these primary care clinicians. They learn from the specialists at the university, they learn from each other, and then they learn by going and implementing these recommendations on their patients.
Project ECHO has been replicated in several U.S. states and in other parts of the world. Another unique element is that New Mexico is one of 3 states that has the licensure for pharmacist clinicians who exercise prescriptive authority through collaborative practice agreements with supervising physicians.
You really are the first line, and so as far as my education, you realize what you can take to the community.
To prepare them for their role in the community, the students participate in team-based learning and an array of experiential learning activities.
In class, they have paper patients. These are patients that are in cases, and they just don't really, there's no emotion there. What experiential learning does is it takes them out of the classroom, helps them apply their knowledge to real patients, so there's real emotion there.
It gives us an opportunity to be the education, give that education, provide screenings to people where a lot of these people don't have those services available.
Also 10 to 15 milligrams.
The tremendous diversity within the student body reflects that of the community. This is evidenced at the One Hope Clinic, where the students have another arena to reach the underserved.
We have developed this clinic to become a part of the community, and we have. The other unique part is that most of the patients speak only Spanish, and so our students do their presentations in Spanish.
The students also deal with patients who recently dealt with the medical crisis.
We've had several patients who have just been discharged from the hospital the day previously. So they actually come to us with no provider, with nothing other than you need follow-up care. And so we initiate that whole process from the medications, from lifestyle modifications that they can do, to educating them about the disease.
And once the patient goes through the process, the students also evaluate how the patient feels about the advice to see if any other needs should be met as part of their care.
We do have salidas, which are exit interviews, and in that way we make sure that the patient understood what was talked about in the room.
Great students, great faculty, great staff, and great partners, whether those are others in the healthcare arena or their partners in the community.